Have you ever pondered over the mystery that is the human mind? Ever wondered why one person's emotional pendulum swings more dramatically than another's? Could it be a personality quirk or something more profound like bipolar disorder? Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. It's like being on an emotional roller coaster, with high peaks of euphoria and deep valleys of depression. So, what causes bipolar disorder? The exact cause remains unknown, but several factors may contribute. This includes genetic, environmental, and neurochemical factors. Individuals with a blood relative who has bipolar disorder are more likely to develop it themselves. Stressful life events or traumatic experiences can also trigger the onset of bipolar disorder. The symptoms of bipolar disorder are divided into two main categories: manic and depressive. During a manic phase, individuals might feel overly happy and energized, engage in risky behaviors, have trouble sleeping, and experience rapid, unpredictable mood swings. On the other hand, during a depressive phase, they might feel extremely sad or hopeless, lose interest in most activities, have trouble concentrating, and even think about death or suicide. The complexity of bipolar disorder makes it a challenge to diagnose. It requires a comprehensive evaluation by a psychiatrist or other mental health professional. Now you might be wondering, can bipolar disorder be treated? The answer is yes. Treatment is usually lifelong and often involves a combination of medications and psychotherapy. Mood stabilizers, antipsychotic medications, and antidepressants are commonly used to manage the symptoms. Psychotherapy or talk therapy helps individuals cope with the disorder, understand their condition, and manage their symptoms. In essence, bipolar disorder is a long-term illness that needs careful management throughout a person's life. It's a condition that swings between periods of elevated mood and periods of depression. Genetic, environmental, and neurochemical factors play a significant role in its onset. Symptoms vary widely and can be extreme, from manic highs to depressive lows. Diagnosis requires a thorough evaluation, and treatment typically involves a combination of medication and psychotherapy. Remember, understanding is the first step to acceptance, and only with acceptance can there be recovery. It's crucial to remember that bipolar disorder is not a character flaw or a sign of personal weakness. It's a medical condition, just like diabetes or heart disease. And so, the journey of understanding bipolar disorder continues. It's a journey that requires empathy, patience, and a willingness to learn. It's a journey that reminds us of the complexity and yet the fragility of the human mind.